Virtual Primary Care Digital Health International Roundtable. No, not, let me say, not a short title for an event, but it's fine. Let me start to share and tell you how this idea of summit was born. Because we have both the Italian Insurtech Association and the Swiss Insurtech Hub. And both our association has a dedicated chapter to health innovation. And last year during autumn, during our regular calls in our chapters, we were discussing about health tech, insurtech, and a variety of eventual initiatives. And these chapters were pretty nice at the end of a day full of calls. These are pretty intimate with a bunch of friends, and we realized that our two chapters have a lot in common. We want to support and promote innovation in health tech for insurance, but we also have a great asset. In both countries, we have a lot of amazing startups in health tech. So this is a great thing, and we decided to do something together, and we decided for a summit. And as soon as we decided for a summit, it was pretty natural for us to open to our friends. We already have a number of relationships with Israel. And Israel is, as we all know, is a brand for innovation, and it is a brand as well for health tech innovation. So today I'm very enthusiastic about this, and we think that this is not only the first, but it will be one of additional innovation sessions as we're having today. So let me like to thank all the people that contributed to this event, and also the leaders of the association. We have Kobe Bendelak from Israel, then Silvia Signoretti from Switzerland, and Simone Ranucci Brandimarte from Italy. And how we are structuring the event today, we have to start a keynote session. So this keynote will help us to frame opportunities and challenges that we have in our field. And then we have finally the startup session. And we have a number of startups. We start with our guests, so the Israel startups, then the startups from Switzerland, and then the Italian ones to close. And we plan to have just 6 minutes of pitch for each startup. We know that is a tight schedule, but this is an opportunity for all the people that are attending to get to see a number of startups. And people can attend today live or afterwards in a recorded session. So now we can start directly with the keynote session. We have Federico Esposti, that is the Chief Operating Officer of Ospedale San Raffaele. Then Kobe Bendelak, Insurtech Israel, CEO. And the third keynote is Patricia Gall, that is founder of SAMI, and at the same time is a member of the Swiss Insurtech Hub. So I'm very happy to ask Federico to start with the first keynote.
Thanks a lot, Paolo, and thanks everybody for this nice initiative. And thanks for inviting me as a keynote speaker. So I'm speaking for Ospedale San Raffaele, that for our foreign friends, I will introduce in 30 seconds, given the time schedule. So Ospedale San Raffaele is the largest Italian hospital in terms of research hospital and technological development. And so as a consequence, we invested along many years in the virtualization of many of our pathways and clinical offer. So when we speak about virtual primary care, the first thing that comes to my mind is the concept of continuity of care. So we start developing as a first tool for virtualizing our clinical offer, a digital platform, a telemedicine platform that started in 2019 and now is the largest hospital platform in Italy, with about 85,000 patients subscribed and requesting their clinical intervention daily. So when we started building this tool, what naturally came out was that the main need that our patient required was not just or not primarily having second opinions, for instance. So using San Raffaele as a tertiary hospital, which actually is. But the main demand that we see from our patients was in terms of continuity of care, so primary care. So if I can describe the 5 main trends that I could see among these requests from our patient from all over Italy and from abroad. So the first main trend was the navigation of the healthcare system. So how we could help them to work as a primary care institution in a virtual way. So clearly this is responding to the large lack of GPs in Italy, and we know this is the same trend is basically present everywhere. So what we found is that the main request in our telemedicine platform, especially in the first months before COVID, was for internal medicine doctors. So they wanted to have a general assessment of their healthcare status, so what their symptoms could be linked to, and have a first navigation into the system. The second main request, and so the second wave of products we start developing in the platform was about prevention. So our patient or prospective patient want to have some modern tools for their preventive pathways. So not just the typical checkups, but building checkups in a both digital and physical pathway. So the main requirement for their checkup was to have a proper navigation, so a personalization of the checkup, not just a personalization of cure. So we start developing pre-assessment visit on our digital platform, so that the checkups were personalized from the very beginning, which meant personalized in terms of risk stratification through genetics or through some physical assessment. And then what came later was a stratification in terms of where they were writing from. So we know that we have various distribution of pollutants around the country. So of course, we have different risk factors depending on where the patient is coming from or is connected from. The third main pillar was, and this is a demand that we are developing an answer to at the moment, is for a broad management of our patients. So continuity means that a lot of our patients, when they travel, they would love to have some service that is able to provide them care in their native language, and being able to an institution that already knows them. So this is a bit a new kind of request for us, and so this is something that we are building at the moment. The fourth main pillar is chronic patients. So of course we are having in charge a lot of chronic patients, primarily linked to metabolic disorders. So we witness a strong request of ways to follow our patients, chronic patients at home, primarily through sensor for diabetes, for glucose, and so on and so forth. A lot of requests for psychological support. This boomed, of course, after COVID. So still nowadays, psychological consultations are the main traffic on our platform, together with the general surgery. And finally, pain management. This is another thing that emerged after COVID a lot. We don't know exactly what is the link between the two things, but definitely we witnessed a boom in requests in this field. So this means, again, is a form of primary care, because what they need, typically, what our patient need, is not a specific intervention, or is not what they typically request, but they don't know how to navigate toward the correct intervention. So they don't know what they need for their pain. So they required a sort of pain navigation. And finally, the last trend is concierge medicine. So again, this is responding to the lack of GPs, and a lot of a growing number of people do want to have some concierge service, which basically is a way to put together personalized care and navigation through the system. So these 5 requests basically came from the people that start requesting services on our platform, and so this has been the wave of services that we have responded to in the last years as for virtual primary care. As a last word, I would say that virtual for us means providing primary, but also dehospitalizing secondary and tertiary care. So building on strong virtual pathways means being able, with time, to conduct inpatient episode at home. So of course, for us, this is building toward a strategic goal that we see in a few years, where we will be able to run some inpatient episode directly at home. Thanks.
Thank you so much, Federico. We are in 3 countries with very different healthcare system, and your contribution is very interesting. And now we move to Kobe Bendelak. Thanks again for your participation. And you're the CEO of Insurtech Israel. So we give you the word.
Thank you very much, Paolo. It's a great pleasure and honor to be here, and thank you for having me here in your great webinar. First, and say thank you for our startups coming from Israel that will present very soon the product and solution. I'm sure that you will be very impressed about what you are going to see. We choose the diamond, but we have here in Israel almost 200 startups, Insurtech startups. I might say that Israel or Tel Aviv is one of the Insurtech capital of the world. I don't think there is a lot of cities in the world that have so many Insurtech startups in one place. So this is the Israeli landscape and the ecosystem. We are leading the ecosystem here in Israel. Insurtech Israel supported startup by 4 pillars. One is investment. We invest money in the startup. The second is business. We assist the startup to grow. The third one is, of course, the exposure tool. We call it media tool. This is one of the opportunities that we are bringing our startup to speak in front of a potential client, investor, and key person in the ecosystem. And we have accelerator program here that we operate here in Tel Aviv during the last 2 years. The Israeli Insurtech ecosystem is very flourishing. We have, as I said and mentioned, 200 startups more, and they are operating a lot of Insurtech segment, stages, and topics. So you can find here a lot of startups dealing with life and health, P&C, cyber, commercial insurance, and a lot of great startups that are dealing with insurance tools like claims tools, underwriting, assessment services, and of course the diamond, the AI. So this is how the Israeli Insurtech ecosystem looks like. There's a lot of people asking me, and because this conversation is not open conversation, so I just ask the question by myself: how Israel become so famous with the Insurtech industry? So that question is people asking because it's really interesting, because Israel is a small country. and the insurance market here in Israel is not so big. And in Israel, from side to side, there's 10 million people. That's all. So it's not so big and big country. And then, of course, the insurance industry is the same. And the reason for that is that because Israel is startup nation, so we have a great infrastructure here for the entrepreneur to succeed. It's easier to be entrepreneur in Israel than other places around the world. It's not easy, but it's easier than other places because we have great infrastructure. For first is the education. In Israel, we have a great university and a lot of great tools for educate people to work in the high-tech scene. Second is the army. A lot of entrepreneurs coming from the Israeli intelligence unit. As you might know, that intelligence unit use a lot of technology. So the entrepreneur take what they learn from the being part of the army and civilize it to the civil side. So this is the landscape, and of course we have a lot of global companies that have a developing center here in Israel. A lot of VCs. You can find I'm sure that you can find here in Tel Aviv, I think, all the global company and VCs that operate around the world. They're based in Israel, so it's very good for the entrepreneur to start. But it's not enough. There is two things that make it even a little bit better, or maybe three things that make it a little bit better. First is the culture. The Israeli culture is to be entrepreneurship people. You know, we are living in a very tough neighborhood, and we need to be independent, and we need to be to have the skill to be independent and solve the problem by our own. This is a great skill for people to be entrepreneur. So the culture here is very unique. There is even joke in Israel that's saying that in the previous time, the Israeli or the Jewish mom wanted her son or daughter will be lawyer or doctor. But now the Jewish mom wanted her son or daughter will be entrepreneur. So it's a culture here in Israel. So this is the first thing. The second thing that accelerates the ecosystem here in Israel is the reason that, from my perspective, Insurtech is not just technology. Insurtech is first bring solution, a good solution for problems, and then implement technology. And this is what we are so good in. The Israel is so good in. Bring or find solution, challenge with barriers, and looks for the goal. So this is the second thing that accelerates the ecosystem. And the last thing, and the most important thing, is the success story. Our ecosystem have a great success story. I don't know how many of you know that Lemonade and Hippo and Next Insurance and Ernix and Sapiens and our Israeli Insurtech startups, all of them based or started in Israel and now operate all over the world. And we have so many more success story, and there are more to come. Some of them you will see here immediately. So from my perspective, the Israeli Insurtech ecosystem is very flourishing and very active, and we are really happy to host you here in Israel, to assist you to learn from our success, to assist you to success by your own. And we are going to operate here in the beginning of September, a global Insurtech summit. So all of you are really pleased to come and be part of that great initiative in the best weather of Israel in September. So thank you very much for having me here in Israel. Not in Israel, having me here in the webinar. Thank you very much, and enjoy the rest of the event.
Thank you so much, Kobi. Very interesting overview. And I took note about September, so I went in the wrong month in the past. Excellent, so thanks a lot. Now we move to Patricia Gal, that is the founder of Osami. At the meantime, she's a member of the Swiss Insurtech Hub, so we have to outline that as well. So Patricia, up to you.
Thank you very much, Paolo. 1 second, because I'm also sharing my screen. Can you see my screen?
Yes.
I think we are seeing the wrong thing. 1 second. We're talking about tech and then we have tech problems. Should be working now. Okay. So hi everyone. Thank you very much, Paolo, and to the Swiss Insurtech Hub, as well as the Italian Insurtech Association for this invite, and for letting me talk about the mental health crisis. As we also mentioned in the beginning of the panel, it is a crisis that we're facing in this moment, and it's the leading cause of disability worldwide, with 1 in 4 people being affected by it. The COVID pandemic has accelerated things a bit, and 50% of people have stated that their mental health has been affected. 10% of the affected people receive treatment, which is quite alarming, considering that 90% either don't receive treatment at all or receive the wrong treatment. There's a medical personnel shortage, with 1 worker for 10,000 individuals in over 130 countries. Imagine that in Switzerland alone, there is a need for another 1,000 professionals in order to cover the demand. We have the loneliness factor. We're becoming more and more lonely with the advancement of technology, and 33% of people report feeling lonely, which is a main driver of depression. The most alarming one and the most dangerous one is the stigma. 60% of individuals avoid seeking treatment just because of the shame of it. And then it's very costly. It's a 1 trillion problem at the moment that's expected to be 16 trillion by 2030. So what do we do at SAMI? At the Swiss Association for Mental Health Innovation, we're a Swiss innovation platform that brings relevant deep tech innovation in the mental healthcare ecosystem. We work with a medical board with which we identify the biggest problems in healthcare and areas that require urgent innovation. Then, together with Analone, a partner company, we communicate directly with the patients in order to deep dive into these topics and find also those topics that really patients really care about. Then we go through an innovation program, and our main goal is to create partnerships between these startups and all companies out there in the ecosystem. I'm not talking only hospitals, clinics, school, universities, but every type of SME or corporate that cares about the healthcare and the mental well-being of their employees. We're going to move to innovation trends. When it comes to prevention, we know very well that keeping a healthy mind and a healthy body really helps in cases of struggles or bad events such as COVID, the loneliness from COVID, or the war that just started, and it makes us more resilient. One of the biggest trends are the biomarkers analysis companies like Aura, that provides a wearable ring that you can wear day and night, and it tells you the quality of your sleep, and it reads your vitals in order to also advise you how to live a healthier life. Then 10 minutes of mindfulness has the same effect as an antidepressant in that given moment. That's why startups such as Headspace or Calm are becoming more and more popular, especially with the newer generations. We know that 30 minutes of cardio on Monday morning is going to produce enough endorphins that are going to keep you until Tuesday at lunchtime. So this is why fitness startups are using AI, like Fitness AI, in order to create adaptive fitness. This type of fitness makes sure that it works your body at the perfect level, not overwork or underwork. And also this affects the mental health. At the diagnosis, in the diagnosis area, things get very interesting. Here there is a heavy use of AI with companies such as Timia. Timia actually makes you play a video game, and what do? They read your micro expressions in order to predict your mental health. Based on the same concept, we have AbleMind that based on the text that you write, it predicts your mental health, or Kintsugi, who does it based on your speech and voice inflections. When it comes to the treatment, We have, the main one is the digital therapy. Here we have two types of companies. The first one is WeBot. WeBot Health helps patients with cognitive behavioral therapy through chat. These both companies are have AI as their main technology, and WeBot does it via chat, but Claire and me does it via phone calls. So you can have a phone call with the AI, and they really strongly believe that if you also voice out your concerns and your problems, it's easier for you to digest them and overcome them. The area of telehealth is a very big one at the moment. We have startups such as Cura Health that instantly connects you to a therapist in order to start your virtual therapy session. And another thing that's very important, it connects you to the therapist that's right for you and for your personality and your problem. We know that it requires around 4 to 6 therapists in general in order to find the one that perfectly fits your needs. Yeso is another telehealth company that also applies cognitive behavior therapy, but through text. Yeso has a very good track record with over 600 professionals that work in order to fight mental health. A real breakthrough is done with Real, a company that only asks you for $28 a month in order to have virtual therapy, but also group therapy. And this we know, we talked about the loneliness. And it's very important to have a group of like-minded people with whom you can talk. When it comes to personalized treatment, we have Flow. Flow is a startup that provides a wearable. It's like a helmet. And then through RTMS, what it does, it helps your depression and anxiety symptoms. You can do it at home. These treatments were before done in hospitals or in clinics, but Flow is really bringing this technology at home to be easier and more accessible to us. Predictix is another company that comes in the help of mental health care professionals. With Predictix, you get a sample of your blood, and then they can really analyze it and see what medicine is actually good for you and what medication will create the lower side effects and is probably has a higher chance of working. A very hot topic is the workplace mental health. Here we have Spill. Spill is a very interesting company because it provides an anonymous way in which your employees can talk about their problems and then direct them to solutions. Kind of the similar mental health workplace solution is Nilo Health, which is has a holistic approach, and its main goal is to find the best therapy and the best solutions for your employees. We're here also to talk about insurance, and I'm wearing two hats, one from the Swiss Insurtech Hub and one from the Swiss Association of Mental Health Innovation. So how do we create a win-win situation? With personalized premiums that use predictive underwriting. If you promise your customers that you're going to use their data in a very responsible way, and you incentivize them to give you their sleep data, their biomarkers, their meditation practice, their fitness, their social interactions, the fact that they spend more time outdoors, and you do all of this by promising them a reduced premium, they will for sure do it because this creates a win-win situation. It keeps people healthier and makes them live a healthier life, but also for the insurance companies, it creates better sales, higher customer retention, and at the same time, an easier way for cross-selling. Thank you very much. You can reach out to me at patriciagal@summit.org or at summit.org, our website. And if you found this speech interesting and you want to deep dive in some details also about the companies I presented, you can just scan the QR code over there and you will be shown directly to my speech today. Thank you very much.
Excellent. Thank you so much, Patricia. Very, very interesting. A topic
Thank you,
that
Paolo.
is relevant for all our countries and ourselves. So it's very interesting. And so let's move to the startups. Wow. Thank you, Ileana, to be so quick. And we start with Israel, and we have 2 startups. The third one, Lava, had an issue, so we cannot present them today, but we will have another opportunity for sure. And we start with Blue Cape. These 2 are very amazing. We have Ian Sanders, the CEO and co-founder. So 6 minutes to you. Thank you. Ian? I think he's coming.
We don't hear you. We see that you're speaking, but we don't hear you. Okay, we see your presentation.
Paolo, non ti sentiamo.
Sorry again. If Ian have to sort out the issue with the microphone, we can switch to start with Alon Silberberg with Uvital, CEO and co-founder.
Hi guys. So I will be more than happy to share my screen, please.
Yeah.
Okay, thank you. Okay, so can you see my screen?
Yes, go ahead.
Okay, thank you. Thank you so much, Paolo. And first of all, nice to meet you. My name is Alon, and I'm the CEO and co-founder of Uvital. Very excited to be here today for the first ever cooperation between Italian, Switzerland, and the Israel Insurtech Hub. So a real pleasure. What I will do in the next 5 to 6 minutes is explain a little bit about Uvital, our company, where we are today, what we can offer for the insurance industry. And if you have any questions, so please feel free to reach out after the session. So let's start. So first of all, let's meet Uvital Health and talk a little bit about our solution. So Uvital is a digital loyalty and rewards platform for members and risk mitigation for health and life insurance. What we offer is a tailored solution that built in order to improve profitability and increase engagement and loyalty for the organization using it. So today we are working with HMOs, insurance, health and life insurers, hospitals even. Working worldwide, millions of members already using our solution. Working multi-language, multi-continent, multi-countries, multi-cultures. We'll get it in a minute. So when we deep dive or dive into the advantages that Uvital can offer for health and life insurance, so we are talking about, first of all, how we can increase engagement, loyalty, retention rates, how we can improve underwriting, or even create what Patricia mentioned earlier, how we can help insurance company to create or improve their ongoing underwriting process when it comes to health and life. We can also see a boost in the loyalty of the policyholders. We can see a boost in health and wellness. And of course, that all takes us to actually affect the bottom line in terms of increased profitability. And we are going to talk about it and how do we actually do it. On the other hand, we can actually save money while lowering potential claim cost or future health claim cost, understand the insurance company to better understand the risk, and then after understanding, actually make the risk go down. So we can actually save money while decreasing the risk. When our value proposition for the insurance industry is very, very simple. First of all, our business model is affordable. We want to be the one-stop shop, or we are the one-stop shop for health and life insurers when it comes to wellness and well-being. And when I say one-stop shop, I mean both sides. So for the insurance company, in terms of services, integration, data analysis, data collecting, and so on. And on the other hand, for the policyholder, everything they need, he or her need in terms of their wellness and well-being will be in one specific, easy to use and interactive application. We offer a user-centered or customer-centric approach in terms of how we understand the market as a one that when we talk about the changes or the trend in the insurance market, we understand that understanding the user, so that will be the policyholder, is a massive, massive change that is need to be it needs to be discussed. And what we offer is the approach that says that it's all about how we can create a better and more friendly experience to the end user in order to allow them to share with us more of their lifestyle or day-to-day living, and therefore collect more data, analyze more data, create more powerful insights for the insurance company. I mentioned already that we are working worldwide, all languages, time zones, countries, and we are going to talk about it in a minute, a little bit more in depth. Our quick and easy implementation process, so we're talking in a very, very short amount of weeks to fully deploy the product. And customized solution, I started by saying that we offer a tailored solution. And when I say tailored, I mean 100% perfect fit for each and every one of our clients, because this is the way we build our platform. So how does it actually work? First of all, we believe that well-being is a 360 degrees approach. So we talk about, you can see here the four main pillars that we are working on while implementing our solution. So the physical well-being, the emotional well-being, the social well-being, even the financial well-being. And I can go into depth and explain how we are doing everything and how we can touch all of those pillars in a very, very strong and deep way. I don't have the time. So again, if you guys have any questions, please feel free to reach out to me at the end of the session. But what's important to understand here is our holistic approach to how we can actually see the well-being and the wellness of your policyholder. And in a minute, we're going to understand how we can help the insurance industry to better understand and mitigate the risk using those four pillars. So after understanding our approach, let's talk a little bit about our secret sauce. So how do we actually implement Uvital solution? What is so special about Uvital solution? So we are talking about using, first of all, the triangle of incentives, the economic, the social, and the psychological incentives, the creation of an all-in-one solution, and then the personalization side of it. So when I talk about the triangle of incentives, what I'm talking about is we use the economic, the psychological, and the social incentives in order to create two things, basically. The first one is how we want to create the motivation, right? So how we can help a policyholder to make the first steps into living a more healthy and active lifestyle. So this will be the first step, the motivation. And the second stage, or the next step, will be how we can actually maintain determination. So making sure that we are using the right incentive for the right policyholder, using different incentives in order to create a long-lasting relationship between our platform, the insurance company, and the policyholder itself.
Around we have 6 minutes. If you can go towards the closing, please.
Yeah, absolutely. So I will do it very, very quickly. So all-in-one solution, we touch on all things related to wellness and well-being when it's come to the end consumer, and also from the policyholder and the insurance company. So we collect a huge amount of data points that we can actually share with the insurance company to personalize the premiums or the cover. Cutting-edge technology. So we spoke earlier about machine learning, AI, smart algorithms that help us to better understand the risk, and then, of course, use different flagging system in order to help the insurance company to understand how and when they should approach the end user. We talked a little bit about personalization. So everything about the app is personalized, starting from the experience, the goals, the way we show and communicate different features and different messages to different users. It's about creating the right experience. And again, I will finish by talking about the impact on your bottom line. We know today, and those are just three examples of what we can actually see using the data and the science and research behind us, that we can actually give 2 times ROI for each dollar goes into implementation UVital within insurance, health and life insurance. Today we are working with some of the biggest health insurers and HMOs worldwide. You can see in the bottom left, Clalit. Clalit is the second largest HMO worldwide, managing just over 6 million members. Together we conduct what is now shown in Harvard Medical School as one of the most large and comprehensive research on human change, of behavior, human change related to wellness and loyalty programs. Again, if you guys have any question or want to hear more, I will be more than happy. Thank you for your time again. Very excited. Thank you all.
Right.
Paulo,
can you hear me now or no?
Yes, you can go.
Unbelievable.
Thanks a lot.
I completely apologize. It apparently switched my microphone for some reason. I didn't even notice. Great. Fantastic. I'll be short. Right, so a massive problem facing the US insurance market and global markets worldwide. Actuaries really want to understand the risk from respiratory diseases. Reasoning why is extremely clear. As COVID becomes endemic across the United States, and we'll focus on the US example, we're going to be seeing anywhere between 100,000 to 250,000 deaths per year. That's from Johns Hopkins. 35,000 to 50,000 deaths from influenza. That's a 10-year running average from the CDC. So that's an upward threshold of 300,000 deaths per year. COPD, another 150,000 deaths per year. Asthma, RSV, you add them all together, we're getting close to 500,000 deaths per year. To put that in perspective, in the US, two of the largest killers in the United States, heart disease and cancer, 550,000 deaths per year. Diabetes, which is the fourth, 100,000 deaths per year. Even at 100,000 deaths per year from COVID-19, you're looking at $82 billion in direct healthcare costs. It doesn't include worker compensation. It doesn't include life insurance payouts. We're looking at estimated losses there at $4.5 billion. So case in point, a lot of money that's being lost. And as an actuary in the insurance industry or the reinsurance industry, I need to better understand these risk factors. So I need data to allow me to better understand these risk factors. That's exactly what we provide. So the world's first high precision epidemiological API. So really just a single sentence, we provide highly accurate, highly detailed, real-time and historical data on the risk from respiratory diseases through an easy to integrate cloud-based API. So this is an example over a count in the United States. This is what actuaries in the US are currently using. This is from COVID community levels. It's at a very large granular level. Useless. From a statistical perspective, after talking to multiple actuaries with some of the largest US insurance companies, they can't find any statistical significance from this. And this is what we're able to do. So imagine that we're able to model the CDC's algorithms extremely accurately, and then through a number of proprietary algorithms relying on a unique subset of pure mathematics, we're able to drill down and provide a much richer understanding of what's currently happening in the space. So we'll go into actually our primary use case, which is in the life and health reinsurance markets. So let's say you're New York Life and you want to de-risk yourself on a block of business that you've done from 2010 to 2014, right? You have $10 billion of a block of business and you put it into a financial product. And you call that financial product a block treaty. And you basically say, after you've done your calculations, that this block of business will put it at 20% of the risk for 20% of the premium, all the money that's being made. I then go to the reinsurance market. I go to Munich Re, Swiss Re, Hanover Re, and I tell them, here's the deal, guys, 20% of the risk for 20% of the premium. Here's all the data. Basically nothing there. Let's say Swiss Re takes that deal. Big mistake. 2 years ago, they lost directly related to COVID-19, $2 billion. Last year, they lost $608 million. This year, the losses will be in the $600 to $700 million range. So they're going to take our data, which we provide a unique understanding of COVID influenza across a given geospatial area, and they're going to do a reassessment of this block treaty. They're going to be able to say, it's not 20%, it's 23%. And what we've just described is called an in-force block transaction. In the US market, on average, take a 10-year average from Munich Re, $300 billion is done per year in life insurance in-force block transactions. So when we even make for them a 0.5 to 1% change, and we optimize this transaction, we're saving them tens of millions of dollars. And really, in the geospatial perspective, which is really what we're bringing into the space, there's really endless possibilities. This is an entire new dimension of looking at risk in the life and health space, better calculate risk thresholds and potential liquidity problems, better understand the actual risk of the portfolio, and something which we have been wanting to do for decades in the insurance industry, dynamic underwriting of treaties. So these exact treaties, we plan on eventually using Blue Cape's data, which we provide in real time, to really create these types of transactions, which can be dynamically underwritten, as in they change with time depending on the risk that we're currently reading throughout a given region that we're operating in. U.S. insurance market is pretty boundless. Life insurance 747, health insurance 1,100, and because global reinsurance is a global market, we estimate roughly 500 players that operate in the U.S. market. So a little bit about the team. I'm an ex-security professional, special forces operator, afterwards worked in security contracting, did a degree in computer science, became enthralled by the area of environmental surveillance, specifically weather prediction modeling. That's kind of what led me into the field of respiratory disease modeling. I'm also a member of McKinsey's Health Tech Network of up-and-coming health tech CEOs. Ori Goldberg served in Shmona Batayim, which is kind of the Israeli version of the NSA. Also ran Lear's R&D Center here in Israel. Professor Itamar Grotto sat on the executive board of the World Health Organization, one of the top epidemiologists in the world. Dr. Roy Yitzchak, a very well-known data scientist, worked on pandemic-related algorithms for the Defense Ministry here in Israel. All of these people have worked tirelessly to optimize and perfect our algorithms. And really, the accomplishments where we're currently at. So top actuaries of some of the largest insurance companies in the world endorse our solution. We're talking to major distribution partners to sell into the U.S. market. And we, of course, as well, are partnering with Sheba as our technological partners to really go together into the U.S. insurance market and really bring our technologies to the fore.
Yeah, and 6 minutes, if you can.
Yeah, of course. I'm actually about to finish right now. So why now in particular? COVID has made it extremely clear to the U.S. insurance market they need to understand these risk factors. Epidemiological data is the next blue ocean of environmental data, and geospatial data is the next frontier of risk analysis for the life and health insurance and reinsurance industry. And COVID and Blue Cape is going to come in right now and become the dominant player in this given market. And that's it. We're happy to answer any questions, and feel free to reach out.
Yeah, thank you so much. That's really, really amazing. Very interesting. And so let's change the country. We move to Switzerland, and I'm very happy to introduce Paolo Fiorentino from Dakadu, sales director. So Paolo, up to you.
Okay, thank you, Paolo. I'm just waiting to be allowed to share my slide deck. Yeah, now. 1 second. Can you see the presentation, Paolo?
Yep, yes. Yep.
Okay, so hello everyone, nice to meet you in this way. My name is Paolo Fiorentino and I'm sales director in Dakadu. And first of all, I want to thank Paolo, the Swiss Insurtech Hub and the Italian Insurtech Association for this opportunity to present today in this international roundtable about digital health. So I have a few slides and I will explain you what is Dakadu and what we do. First of all, I would like to start presenting Dakadu from a company or corporate point of view for the ones that are not really familiar with Dakadu. I just want to tell you that we are a B2B health tech insurtech company. We were founded in 2010 in Zurich, Switzerland, so we are Swiss based. We currently have more than 120 employees all over the world. And as you can see from the slide, we develop technology solution for digital health engagement and health risk quantification. So the digital health engagement is our platform that we have here, which have as an upstream our wheel of life that we work with users in order to improve their health and their lifestyle and their quality of life. And downstream, of course, we have our health risk quantification with the risk engine, which we can use more for life insurers to, score mortalities and morbidities in real time. So basically what we do after presenting Dakadu from a company perspective, our value proposition in a nutshell is basically what you can see here. We connect, score, and engage users for a better quality of life. So we truly believe that health, and especially if we focus on digital health, must be relevant and meaningful for the users. So we connect users to the platform. We give them a score, an health score. So this is our way to help users to understand how they are doing with their health and their lifestyle, how they can improve health and have a better quality of life. By definition, this is really important, because if we cannot score, so if we cannot measure, we cannot have a long-term engagement with the users on the platform. So after presenting, Dakadu from a company perspective, from a value proposition perspective, I want to focus on this slide and on the next slide a little bit on how we see this industry, digital health industry and healthcare industry nowadays and moving forward. So we truly believe that the industry is shifting from, an assuming risk perspective to a preventing risk perspective. So we no longer, of course we do, but we are changing the paradigm. So the focus now is not only to, take care of the sick people, but we are actually trying to do all the best in order to keep the people healthy. And you can see this number here, because today 85% of global deaths are due to non-communicable disease, where cancer and, for example, diabetes have a huge impact. The risk factor, the most important risk factor, are smoking, diet, alcohol, and activity. And people are actually moving less than 60 years ago. So this is what we can, manage and what we can improve by our quality of life. And by McKinsey, we know that globally we are spending more than $8 trillion per year on global health care. And always by McKinsey, we know that through digital health, we could, save up to 25 or 30% of, data expense. So we truly believe that digital health and healthcare is important, and it's about, our quality of life. So finally, we also believe that actually any stakeholder involved in such industry, digital health, platform economy industry, has and will play its own role, from payer and insurance carriers that are interested to operate the digital platform, because actually there is no insurance without data. And we saw in the previous presentation how this is important. Consumers and users, of course, are really interested on this topic, as well, as we said before with the health score, because they want to have a better understanding and want to give a better value of their data and their personal health. Employers, we know nowadays the importance of ESG is mainstream now. And of course, they are very interested in the talent and good health of their team. And we see a lot of, corporate wellness, corporate well-being projects all over the world. Providers need to provide great data and digital health outcome. Of course, the governments are also, involved in this world, which actually should public organizations should drive digital health trust by actually setting standard and policies, and to incentivize users to share their data with carrier and provider and employer. And last but not least, the last player of this stakeholder embedded economy are retailer, market chain, supermarket chain, or grocery pharmacy that actually are nowadays focused on healthy living, because they know that on healthy living they can have better margin and higher margin, so they can also keep the clients with them happier, longer, and with a better quality of life. So finally, we truly believe that, yes, I'm almost done, Paolo. We truly believe that digital health, it's about quality of life, and it's a massive opportunity for the society, and we are very interested and very excited to be part of this journey. So next slide. So I'm done with this. Thank you for listening. Here you have my personal email account. If you have any question, don't hesitate to reach out to me. Thank you.
Thank you so much, Paolo. Very, very clear. And now we move to Anton Isaacson, Business Director of Fujool, but here, please, I already know that I'm pronouncing the wrong way. So Anton, let us know how we should pronounce your startup. Perfect.
Thank you, Paul, very much. And thank you for this invitation. I'm stepping in Sasha's, our CEO's shoes, and I'm a business developer at Fuel, and I'm going to present you Fuel. Is how we pronounce this. Let me see if I can share this. Everything should be fine now. Do you see this in presentation mode?
Yes, go ahead.
Yes, perfect. All right. So how we see the world, first of all, I mean, like your other has said, I mean, the world is facing a huge challenge, and it's changing very, very fast. People are getting more obese, and they are getting less active all the time. All the time, studies show that people are less active and more obese. And at the same time, there's an increased risk of people getting sick and different diseases, and people are actually dying from these diseases. And that's a real problem. But then we have a lot of research that suggests as well that with physical activity, you could actually treat a lot of these diseases, and not only treat, but also prevent. And this is where the world is shifting as well at the moment, from treatment to prevention, preventive care. And there are certain guidelines to reach, to increase the actual survival benefit of yourself. And we are doing this with Fuel as well, according to these guidelines. What we do is basically turn all biometric data from different trackers, from apps, the phone itself, into scientifically validated and easily measurable 2 metrics, which are Fuel points and healthy minutes. And with these 2 metrics, we create different kind of bonus and loyalty programs, rewarding schemes and mechanisms to enhance people's activity, to maintain people's physical activity, and of course, as well, coach them to reach certain activity levels. And this is together with our analytics platform. It turns it into quite a big load of data that is measurable, and we can actually track the value of what we are getting from the pool of these people that are using the service. And in the insurance space, it means dynamic pricing and underwriting as well. When the risk portfolio is turning from actually measuring the risk by your age, we take physical activity there, and we can lower the risk dynamically, which turns into something that the actual insurance taker can see as decreased premiums, as cashbacks, or different kind of rewards in that whole ecosystem. I'll present a couple of cases as well. Helsana Plus is our flagships, which turned from a couple from about 20,000 users into over 200,000 users, and that's where we have inserted our SDK from Fuel into their existing app, made the connection, and turned the whole system into a bonus and loyalty program where actually moving, being physically active gets you different kind of points and rewards that are basically these cashbacks and different kind of discounts from partners, etc. And of course, this has boosted their customer satisfaction and NPS and tremendously increased the retention and of course the lifetime value, which goes hand in hand. But then another vertical, which is occupational healthcare. First and foremost important thing is the actual person that is using the service. They need to have it really simple. They need to have certain levels that they can reach, that are reachable, and they see the reward. So when they do certain things, they get a reward. The healthcare provider can combine this thing into their platform and service by offering both human interaction, but then taking this activity platform and with all the data analytics behind it to actually provide better, more accurate care for the patient, and not only care and treatment, but prevention. And that's where we are shifting. Thank you from my side. I think the time is up. So feel free to connect.
Well, 1 more minute if you like.
1 more minute.
Yeah.
All right. Yeah, I mean, feel free to ask something. Let's keep a minute for that.
So let me say one thing that I really like to outline, that you're not from Switzerland, and also after we have not a Swiss company, but we're very, very happy to host people from the Swiss Insurtech Hub ecosystem. So we love to be open, and so there's an opportunity to stay as open as possible.
Yeah, and we thank you for that opportunity. We've actually been a long time in the ecosystem as well. And that's where our story started, even though we are from Finland.
Yeah, excellent.
Yes.
So
Thank you.
Thanks, Elon. Anton, now we've moved to Jose. Jose Bastos is a CEO and co-founder of NOC Healthcare.
Hello.
You should be able to share your slides, I guess. Juliana, is Jose allowed to share his screen?
Hi, Paolo, but I see that he's not online anymore. I think he has some connection problems.
Okay, so we can switch to the next one, and then we come back to Jose in a few minutes. So now we enter Italy, this time third country, and we have Capsula, very interesting startup as well, and we have the founder here, Alessandro Nizzardo. It's your turn now.
Okay, thank you. Hello, everybody. Thank you for the invitation. Thank you for all the speakers for the wonderful presentation. I would like to get in touch with all you.
Hello.
So now,
Sorry, I think.
Jose.
I think I've had a problem with sharing my screen, and something crashed. Can you guys see my screen now? You can see my screen, right?
Yes. Sorry, we are conflict. So let's go ahead with Jose. Sorry, Alessandro. Sorry. So okay, Jose, your turn.
All right. Oh, thanks for having me here. And what I want to share with you is to ask you to think what the future of telemedicine is like. So imagine the future of telemedicine, and what comes to mind? And you are probably thinking of this, right? Which is a person just looking at the computer and speaking with the doctor. But what I have to share with you today is that that part, the communication, the technology, is only a small part of what telehealth will be in the future. Because telehealth is so much more than that. You will gather data, you need to gather data in preparation to a consultation to give the doctor the best resources for their time. You do the teleconsultation, yes, then you have to be able to do the post-consultation, to gather additional data, to do plan follow-ups, to accompany the patient, to do the continuity of care. And with all the data points that you gather, you are able to obtain clinical and operational insights that on one hand will make the doctor's job easier and more efficient, and on the other hand, the management of the operation also more powerful. So what NOC is doing is powering a better health system. We deliver better outcomes for patients, better performance for practitioners, better performance for healthcare systems, and ultimately we are able to deliver all this cheaper, fairer, and more accessible to all. And how do we do that? Because of the power of data. If everybody says that data is healthcare's new currency, our vaults are getting quite full. Right now we have over 20 million structured data entries, 9.6 terabytes of information. So imagine the power that we can achieve with that. And I'm going to go to show you some small examples of that. So in terms of the service that we deliver or the technology, we basically deliver an end-to-end telehealth stack. So in countries where required or for clients that are required to deliver a medical staff, but to any country, any client, anywhere in the world, we deliver the tech, we deliver the health data, and we deliver the insights, all integrated in one single platform. And we have the results to show because we are improving health outcomes from day one and in a very strong manner. As you can see here, based on real world data, in a sample of over 500,000 consultations, we have achieved the resolution rate, or our technology has achieved the resolution rate of 87.5%, with great ratings in terms of doctor experience, patient experience, doctor rating. And here, very important, 97% of the consultations were considered helpful by patients, and only 4% repeated and after 24 hours, and only 9% after 7 days. These metrics are able to beat a lot of the unplanned consultations in hospitals in acute care. And this works, and I have some evidence here again that it works, more data to demonstrate how it works. In the year of 2022, we have onboarded over 200,000 new patients, and to those patients, we've delivered over 2.7 million minutes of consultations, which means that in the course of one single year, we have delivered 5.2 years of medical consultations. So to the right in this slide, some data, 750,000 interaction with patients, over 4.5 thousand doctors using NOC, of which 600 managed directly by us. Our technology still powers over 1,000 appointments a day, with a global net promoter score of 86 and 26 clients served globally. And who are our clients? We have payers, we have providers, and we even have pharma. For payers, we are generating savings because the more you are able to avoid people to use unnecessarily healthcare, or the more efficient you render the doctor's time, of course, this means savings to them. So insurers, even municipalities are now using our technology for their citizens. For providers, why is this really good? Because as you follow up patients in an asynchronous way, you are basically making the doctor's time more efficient, you are creating engagement, you are making sure that people adhere to their treatments, and so they have a success story in each patient. And for pharma, we are working to boost new drug adoptions. Why? Because the problem that sometimes pharma has is that they launch drugs, but they are not able to see how patients are using them, if patients are using them, and especially for chronic disease, this is really important, and our technology powers that. So where we are today in augmented telemedicine, we deliver continuity of care, it's non-invasive, it's early diagnosis, and it really helps. Where we want to move forward to is to evolve our technology into digital therapeutics. We believe the time is now to grow, to build on all the data to deliver something really special and unique. In terms of the journeys that we do, of course, acute care, we've discussed it already, but again, for insurers, patient engagement, we do a lot of mental health, and I'm going to detail that in afterwards, and of course, elderly care, cardiovascular disease management, lower back pain, among others. But here the point is we have already 9 journeys going live, and we have quite a few on the pipeline, and we're super excited about this. Speaking of mental health, and because we were discussing it earlier in this discussion, I wanted to show 2 use cases. Mind Health, a program that we launched for corporates, and this is a specific use case for a company where for a number of patients that are being intervened, 38, we have already done 255 consultations, and of which psychology and psychiatry integrated. And you can see below the results, a 17% improvement in burnout scores, another 17% improvement in depression, 10% in anxiety, and 15% in insomnia. This is global population. This is basically aimed at insurers. And again, another use case. Basically, we quantify the risks at the beginning with a response rate that it's above 80%. We are able to reduce the no-show rate to below 10%. And again, very high response rates, very big success in dealing with depression. And after all, I guess if the whole world is now worried about mental health, it's this sort of technology that we need to deliver and to make it really effective. So thank you. These are my contacts, and please reach out if you want to find out more about this.
Amazingly on time. Thank you so much, Jose. Thanks for your contribution.
Thank you, Paolo, and sorry for the delay.
No problem. No problem at all. Now we move, as mentioned, to Alessandro.
Here I am again.
And Alessandro Nizzardo, Capsula, founder of Capsula.
So thank you very much for the invitation. I was saying before that I really appreciate all the presentation of the speakers. So I think we will get in touch if you don't mind. Can I have the share screen? Yep. Should be able to see my PowerPoint. So just briefly, who we are. Capsula is a startup we founded in 2019, but the story is a little bit longer because I founded the company in 2008, with which we started to develop a cloud and IoT platform starting from 2013. And based on the fact that what we really know is the huge need people have to be empowered, to know themselves and to take care of themselves, and for prevention, for whatever is about health, we decided to found Capsula in 2019, looking at a completely self-user experience for people that want to know themselves through different kind of devices and tests. So our mission is to build a digital ecosystem for user-centered healthcare. What is Capsula? Capsula, as I told you, is a digital ecosystem because we do have 2 different touch points. One is a physical touch point, an airport, and the other one is a digital touch point, wherever you go after doing your test inside the airport. The airport is we focus very much for the user experience, both physically and digitally. So to have an immersive, a very simple way to use a different kind of devices, and then to have the answer to the needs you take out while you are performing this test within our web app. So as mentioned, these are the tests we are able to perform inside our HealthPods. This is not a statistical picture because we are always scouting new technology and try to find a way to make them touch the ground together with our capsula. And all this data goes together to build, let's say, a data set that we call a digital me. So the measurement taken in capsula plus some online questionnaire provide, let's say, an holistic view of the person. So that you can see two different layers. One is about vitals, and the other one is about lifestyle habits linked to well-being, mental, physical, and emotional well-being, and about activity and nutrition. And I share with Paolo Dacadou that the 84% of non-communicable disease are directly linked to lifestyle habits. So, I mean, it's very important that everybody needs to have something to the way to take care of themselves. And the way is, from our point of view, to enable an ecosystem of third-party offering. So starting from telemedicine, then we do have an AI lifestyle assessment, health, wellness, and insurance offering, digital therapeutics, but also from a physical point of view for self-triage procedure inside hospital or having a remote consultation direct inside the health. Here we have some of our partners inside, let's say, our marketplace. Of course, all of this give a lot of data. This is an example of what we give, for example, for in corporate well-being program, where we can give the HR the overview or how healthy is the population, so to define which are the best strategies to go through. We do have two kinds of offering. One is capsule lifestyle that is based on different kind of measurement and the digital twin, but basically is for prevention through lifestyle. The other one is more from a clinic, an efficiency for the efficiency of the procedure inside the hospitals. It's capsule clinic because it's based on triage and the possibility to have inside the pod directly remote consultation. These are some of the installation we had last year. So as you can see, we are really in a different places, from event inside corporate well-being, for insurances to promote their digital health or digital health insurance tools, inside clinics, retailers, different kinds of application. And we are quite happy because wherever we put capsula, we like to see people queuing. So at the end of the day, we do have 4 different values with capsula. The first one is the test. So it's the new customer journey for the user. Then we do have the qualified lead because we make promotion of digital and physical services. Capsula has quite a good media impact because it's difficult not to see it, and also from an ethical point of view, because we are talking about lifestyle for prevention through lifestyle. And then, of course, all the data that can be very useful for assessment of a community needs and to understand the effectiveness of the strategies that are implemented. We want to go from cure to care. So we give this empowerment to people. We give them a digital twin. With this digital twin, they can go to see different kind of needs, to solve different kind of needs inside an ecosystem of third party, because we make integration with whoever is able to take care of people. So we make the engagement, the measurement, and the test. This is in the view of the 5P medicine, and we provide for sure a participative way of living the health. We try to have a data set, a digital me, that personalized path. And then, thanks to our partners, we give more pluri-expert services, prevention, and prediction. I think it's gone. Okay, thank you so much.
Alessandro, thank you so much for your presentation. I'm very happy to see very different solutions, so covering different aspects in different ways of health. Now let's move to Clingo with Simone Novelli, partner and medical director.
Hi, hello everyone. Could you please able me to share the screen, please? Yeah, now I can. Can you see my presentation? Okay. So first of all, I want to thank you, especially Paolo and everyone, for this lovely initiative. And I am Simone Novelli, one of the 3 co-founders of Clingo. And what I'm trying to do the next 6 minutes is try to explain and present our startup. So basically, Clingo aims to be a player to monitor and control personal health. How? By shifting our consumer healthcare, making it open and patient-specific, using data, healthcare data, to impact patients' well-being. Where did all of that started? I mean, nowadays, especially in Italy and especially in the last 3 years of pandemic, people don't want to waste more time than necessary, and once they have their life more organized. This way of thinking is involved also in the healthcare world. And what we are trying to do to solve part of this problem is, on one end, send our self-sampling kit at home for blood and genetic test, and on the other end, trying to build an healthcare platform where all the data of our consumer are safely stored, easily to understand, and where needed and necessary, request to talk with a professional. In other words, what we are trying to do is that customer doesn't need to worry about their well-being because Clingo will think about it. Here is showed the content of our box according to the request. For example, for blood, for urine, for DNA, so with a swab, and so on. How does it work for our customer? It's really easy. They buy their kit online, they receive their kit at home within 3 days, they send it back to our labs. And just a quick point regarding our labs, we use state-of-the-art laboratories that are currently working with hospitals and clinics in Italy. After a period for blood tests is really short, within 48 hours, for genetic tests are longer, they check their result online, and if needed, they talk with our professional and medical team. These are an example of our blood test type, divided by categories, and we decided to name it with a more understandable pattern instead of scientific name. For example, thyroid prevention, heart, stress, and so on. This is a zoom of one of our packet, of our box. For example, vitamins. You can see a description why they are important and which biomarkers are included. Shifting on the genetic one, the genetic analysis are divided in 3 main categories: sport, nutrition, and general health screening for a good well-being. This is a layout of our website that is on when customer can log in, sign up on our platform, and buy their products. The second part of our project is our platform. So where all the personal area of our customer can be accessed rapidly, they can check their health data, monitor their change, is easy to understand, and they will be advised for supplements, for kind of diet, and so on. Moreover, there is a tool for video consultation, so they can book directly through our platform a consultation with a GP or a special or a doctor with a specialty. Sorry for that. Inside the personal area, so each customer can rapidly and see their test they performed and monitoring both result and they're changing through time. Our next goal is, as I mentioned already, we have a patient-specific path is already available online with the aim of supporting customers to choose their best kits based on proven medical data. What we are developing now is an artificial intelligence platform, so our model could be more and more patient-specific, and we can drive our patients to the correct analysis and correct pathway to do it for their future. I hope I was inside the 6 minutes. So for any doubt, concern, or more information, please feel free to contact me. Thank you very much.
Thanks a lot, Simone. You're really on time.
Thank you.
I was thinking that I wish my son is following this the same the time as you are doing. So this is great.
Thank
And
you.
now, last but not least at all, and another perspective of health innovation. We have Mario Ghezzi, CEO of Mia Care, Mia Platform.
Thank you, Paolo, and thank you for having me and giving the opportunity to present Mia Care today to all the speakers and attendees of this webinar. So I'm going to share my screen. Let's see if you can share it. Okay. All right. So we are an Italian software vendor. So through the years, we develop our flagship product is Mia Platform. It's a platform development toolkit, cloud natives, and based on the modern architectures, microservice and API based, we offer to many companies like the opportunity to go and not build as a greenfield, right? So their digital assets, but leverage our software suite in order to get on the market quicker and faster and more in a more efficient way. So we had launched this product around 2016. Mia overall today counts more than 160 people. As a Mia Care, we distribute the product into the healthcare and life science market. We have an international footprint. Today, we are present not only in Europe, but also in US. We count more than 10 different customers. We grew substantially year over year. So the last year was terrific. We scored 300% growth, and we have more than 1,000 users, active users on a daily basis on our platform. So we work a lot with the insurance ecosystem. I put on this slide few names. Some of our major customers today are Vittoria Assicurazioni, Helvetia, Cattolica. It's an historical customer of us, Previ Digital. So those are large corporate that today they benefit, right? So of using our platform to create the digital assets. Oops. Okay. So what is the problem we solve for the industry, right? So today, so there are more and more touch points that are used, right? So on the digital sites, right? So different channels in order to harvest data from different type of users, like patient, doctors, and those data needs to flow and be connected with the system of records of the organization. So traditionally, right, so you do the spaghetti integration. So this chart explains very well, right? So what that means. And this spaghetti integration costs a lot of money, create a lot of, I would say, bottlenecks, inefficiency, and still keeps the data sealed, right? So instead, what we offer, it's a product that will connect those digital touch points with the system of records using our platform builder. So this platform builder is very, I would say, it addresses different type of products. One is the interoperability of the data. Two is to move, I would say, most of the logics that you use to create application on the cloud side. And with that, right, so you can benefit in terms of reusability, modularity, and integration of your application and your native code. So the way we do that is with two major assets. On the left side, we have our internal developer portal. It's a tool given to the feature teams in order to do to manage end-to-end the software lifecycle on the cloud. That essentially avoids the team to go through the complexity of building application, microservices, API on the cloud. So you don't need to get in every single aspect of any single application, but with I would say a low code and no code front end solution, they can manage, I would say, very easily the complete software lifecycle. On the right side, we have our marketplace. It's a catalog of ready to be configured components that again will help a customer to accelerate the time to market for their regulated application. So what we enable, so we help customer to move fast and more, I would say, efficient, right? So from time zero to the moment they need to release their digital asset on the cloud. So therefore, we speed up the development and the overall cost of managing an application on the cloud without any lock-in. The platform is capable to address different layer of digital platform, from all your relevant data to the business logic to your digital products. And the different way the platform today is used by our customer, right? So it's not just to compose a modern architecture on the cloud to address different use cases on the healthcare ecosystem, from, I would say, telemedicine platform to connect regulated medical application to the cloud, but also to create data virtualization platform. So platform that is capable to manage data ingestion, data transformation, and provide, I would say, the access to different users to those data sets.
6 minutes.
Yes, it's at the end, right? So again, different customer today that benefit this solution that is totally compliant with the major regulation that today are on the market. So at the end, so we want to say develop fast, develop smart, and develop secure through our platforms. Those are, I would say, the major assets you can benefit through the solution. Okay, that was the last one. Thank you very much. If you have any questions, so those are our contacts, and very happy to answer afterwards.
That's a compliment. And then I like to see your platform at the end after all the vertical startups. So it's, there is a kind of logic, let's say, in the flow. So after 1 hour and a half, we are 4 minutes behind schedule. So everything was working. And just to close, let me say that I'm personally very, very happy. I mean, it was very new and exciting experience. And in the end, we had 12 speakers from 5 countries. So not too bad. It's startup with a variety of solutions. And what is nice to see that we are 3 organizations, non-profit, and our cooperation is working. We've done a quality event, so this is a good thing we can move ahead from. And so we reached some of the best startups at an international level. So it's very interesting also in terms of content. So let me thank you again, all of you, either from the speaking side or the participant as a attendee, and thank you again to all the people that support us from the logistic point of view. So thank you again, and meet at the next time.
Thank you, Paolo. Bye, everyone.
Thank you very much.
Thank you very much. Bye-bye.
Thank you. Bye-bye.
Bye, bye, bye. Ciao.
Thank you. Bye-bye.